Is your child having fever? Calm down. Let me tell you what to do. Now the next question is, how do you know if your child is having fever? Is it a high-grade fever or is it a low-grade fever? That is why as a mom you need this. This is what will tell you if your child is having fever, high grade or low grade. So I am going to be teaching you how to use this thermometer, and then I am going to be teaching you what to do, the drugs to use when you get the readings from your thermometer. So now, how do you use a thermometer? So this is a digital thermometer and it is very easy to use. Anybody can use it. So you open it and then you bring it out. So this is the thermometer. First of all, you clean it. When you clean the thermometer, you put it under your baby's armpits. Make sure to turn it on and then you put it under your baby's armpits. When it finishes reading, which is usually a minute, it's going to beep. So you are going to look at the reading. If you get between 36 to 37, your baby is fine. But the normal body temperature is 36.5. But anything between 36 and 37 is fine. So if you get below 36, it means that your baby is cold. You have to put some clothing on your baby. But if you get above 37, it means that your baby might be hot. You have to take off some clothing. But when you are now having 37.5, your baby is already having a fever, a low grade fever. Now your baby is having a low grade fever. You know, with the use of a thermometer, what should you do? If your baby is less than 3 months, you need a paracetamol drop. And paracetamols are given based on body weight. We use 10 milligram to 50 milligram per body weight. So let's say your child is weighing 3 kg. So your child is going to need 0.3 mils. That's 3 times 10. That is 30 milligram times 5 milligram divided by 100. So your child is going to need 0.3 mils starts. And then you are going to watch out. If your child is having fever, one thing you must know is that fever is a response of the body to something unusual. There is usually something causing fever, but what we are trying to do at this stage is to bring down the fever, because a fever that is not well controlled can lead to convulsion, and you don't want that for your baby, right? So if your child is above 3 months, then you want to use a paracetamol syrup. So using paracetamol syrup also depends on the body weight of your child, and it is 10 to 50 milligram per body weight times your child's weight. So you want to give some syrup to your child if your child is having fever. Now let's talk about how you handle high grade fever. Alright, so now let's say your child is having a high-grade fever. High-grade fever is a temperature that is more than 38.5 degrees Celsius. You want to act fast. So the first thing you can offer your child is ibuprofen. You can offer your child ibuprofen syrup to quickly bring down the fever, to bring down the temperature. So ibuprofen syrup is given 10 milligram per kg. That's 10 milligram times the weight of your child. Or better still, you can use a suppository. So now you want to ask me, when do I need to use a suppository? You want to use a suppository for a high-grade fever. You can use a paracetamol suppository, or you can use a diclofenac suppository. Suppository are better or more advised in high-grade fever because they are fast-acting. So if you want to bring the fever down immediately, I advise you use a suppository. Remember, I started by saying that there is something causing this fever. So using all of this drug doesn't mean you are curing the problem. No, you are just solving the problem temporarily. So the next thing you want to do is that you want to run to the hospital. You want to get your child tested. You want to run some lab tests so that the doctor can find out exactly what the problem is and can prescribe medications for you. Dear mothers, things I just talked about are emergency treatments. They are not the main treatment. So when you do this, please carry your child and go to the hospital. Do not abuse all of these things. Do not abuse any of them. They are used when necessary, and make sure you use it in the right way and seek the advice of a professional. And with that being said, my name still remains Jade, your number one go-to for everything baby. Do not forget to subscribe, like,